Hi, I'm Dr. Bill Gradisher, Professor of Medicine at Northwestern University, and I'm pleased to join you to have a discussion on this yearbook YouTube video about dense breasts and what the implications are. First of all, it's important to understand that density is something that we think about with respect to imaging. That is, when women are undergoing breast imaging with the mammogram, a report may come back indicating that a woman has dense breasts. And radiologists are able to grade the degree of density using certain metrics that they have. And we know a couple of things about women who have dense breasts. Number one, dense breasts can make the identification of any abnormality in the breast a bit more challenging. And the way to think about it is that the purpose of a mammogram, as an example, is to show contrast between what is typically fatty tissue and something that shouldn't be there. So when you look at a mammogram in a patient who is, say, in her 50s, 60s, or 70s and is postmenopausal, the density of the breast typically, but not always, is diminished because the breast is composed of more fatty tissue compared to a much younger woman. So you can see contrasts when you look at a picture, a mammogram, where the fatty area is sort of gray compared to areas that may be more suspicious that are, say, a nodule or a mass that appear very white. So you have this contrast between gray and white, making it much easier to see. Now, if you think about that same scenario where the entire breast is white, which may reflect density, it can obscure underlying abnormalities. In order to really understand whether or not there's anything of concern present, additional testing may be done. And that may take the form of an ultrasound or an MRI. And the radiologist typically will indicate the degree of density and whether or not they feel that imaging with additional tools are necessary. Breast density is really a reflection of the ratio between the different elements in the breast, the glandular tissue, the fibrous tissue, and fatty tissue. And as I said, as women age, it's not uncommon for fatty tissue to make up more of the breast, making mammograms easier to read in most patients. The second issue, of course, is does simply having dense breasts mean that I'm going to get breast cancer? And the simple answer is no. Most women with dense breasts on imaging do not get breast cancer. But if you take a large population of people with dense breasts compared to those that don't have dense breasts, the fraction of patients who have breast cancer at some point in their life is somewhat higher in the patients who have breast density. So again, it can be a risk factor for a group of patients, but simply saying that I have dense breasts does not preordain that you will get breast cancer, but it may require greater vigilance in evaluating the breast as you go forward. It's important to understand that probably about half of patients have dense breasts, and as pointed out earlier, it doesn't mean that you're going to get breast cancer. It just means you might have a slightly elevated risk. And the FDA has actually sort of mandated that this be incorporated into imaging reports so that not only the clinician but the patient understand that breast density is present and additional imaging tools may be required. So this helps with the next steps if a woman has breast density issues, whether or not further imaging should be done, and if so, that report allows those things to be done and covered by insurance. So if you have or have been told that you have dense breasts, it may require additional imaging. Sometimes the frequency of imaging is different too. We, of course, never are recommending that women get multiple different imaging studies over the course of a year, but rather than getting annual mammograms, a patient may be asked to alternate an MRI with a mammogram, or they may get specific types of imaging which may be more sensitive, like 3D mammograms, or they may have ultrasounds done at the same time as a mammogram is done. And this is, again, at the discretion of the radiologist. because they're trying to optimize their ability to see what is present in a woman with dense breasts, and particularly address any concerns if there's something suspicious, and a mammogram itself alone may be inadequate. So these are different strategies that are employed. It's individualized according to the patient. If you'd like more information about this topic, go to yerba.com. If you'd like to learn more about your specific clinical scenario and the options available to you, both the pros and cons, again, go to yerba.com. So after this long discussion, the fundamental question comes up, are mammograms still worth it? And I would submit they are. We know that it's not a perfect tool, but it remains the best screening tool we have, and we use it as a foundation for whatever additional testing is needed. So we would still recommend mammograms be done. The technology related to mammograms has improved somewhat. And of course, we have complementary tests that can be done depending on an individual patient's situation, including ultrasound, MRIs, 3D mammograms, etc. So all these tools are employed to make sure that we identify any issues that may be present in a patient and then take the next steps if needed. So I hope you enjoyed this discussion about dense breasts. I look forward to talking to you again. Thank you.